Hi, my name is Dr. Odinachi Oguh. I am a movement disorder neurologist here at Cleveland Clinic. I do direct the comprehensive ataxia clinic at Cleveland Clinic. What is Friedreich's ataxia and what should caregivers know about its progression? So Friedreich's ataxia is a type of genetic ataxia. It is an ataxia that is inherited in an autosomal recessive way, which means that both parents do not present with the disease, but they do carry the genes, and it is then transferred to the child at a 25% chance. It is a slowly progressive condition over a long period of time. Some of the more clinical symptoms that we see in Friedreich's ataxia include difficulties with walking, changes in their sensation, so they lose sensation in their feet, difficulties with coordination of their hands and legs, as well as changes in their speech and eye movements. What is the best advice for caregivers to support their loved ones? Being a caregiver for someone with ataxia can certainly provide a lot of caregiver burden. It weighs on your physical, mental, and emotional needs. I often tell my caregivers that you often want to take care of yourself first so you can be able to take care of your loved ones. One of the things that I always advise, always let the patient assume as much independence as they can. So if they're able to, you should allow them to. Always keep lines of communication open. Addressing someone else's needs can certainly have a tremendous effect on the caregiver. But open lines of communication, not just between the caregiver and the patient, but also with their medical team. I do often advise making sure your clinical team understands your needs so that we might be able to help you provide the best environment for you and your loved one. How can caregivers best address their own needs? Caregivers should be able to address their needs in many ways. And I always say, you first before the patient, because if you don't take care of yourself, your care for your loved one certainly will be minimized. We often say that caregivers should seek support from not just a social worker, but also mental health professionals. There is a high rate of mental mood disorders in caregivers, so addressing that need is going to be very important. Seeking out your tribe, taking some time to enjoy your own hobbies can be important. And I do know leaving that patient or your loved one alone can be frightening, but that self-care time would be important for you so that you can continue to provide the care your loved one needs. There are many foundations and societies that can help provide what we call respite care so that you can partake in that self-care for the caregiver. Joining support groups can sometimes be helpful. I certainly do know that some of our caregivers find that frightening, but there's a sense of collective support when you do join a support group, and the support group might even have more answers than sometimes many providers because they live in that Friedreich's ataxia ward and they're able to help you navigate the process.